Okay, so coming into the room, I would knock, wash my hands, ensure patient privacy, and then I would come over and introduce myself to the patient. Hello, my name is Marialys, and I'm going to be your nurse today. I'm going to be doing an NG tube for you. I'm going to be inserting it. Can you please tell me your full name and date of birth? Thank you. Do you have any allergies? No? Okay. I'm going to raise the bed.
Non-sterile hands, regardless by the label, without touching the arm, or
And I'm going to put the patient in high Fowler's position.
alright. Proceed to putting on my glove.
60 degrees is good. And then I'm going to assess their gag and cough reflex. So I'm going to ask the patient to cough. Cough. Okay. And now I'm going to assess the gag reflex. And I'm going to look in their throat with a pen light. Okay, their gag reflex is good. And now I would take their vitals. I would attach a pulse ox, and I would take their vitals. I would do their temp, check the heart rate and the blood pressure, and yeah, the pulse. And then I would test nasal patency. So I would ask the patient, I would hold one nostril, and I would ask the patient to blow out of there. I'm gonna hold this nostril. Can you please blow out of your other nostril? And now with this one. Okay, this is the more patent nostril. So this is the one I'm gonna use for the NG tube. I have my supplies here. And I'm going to put on clean gloves.
Section.
And I'm going to open the NG tube packaging. I'm going to take it out. And at this time, I'm going to open my packet of lube and squirt some of it out. So now I'm going to measure the NG tube from the tip of their nose to the earlobe to just below the xiphoid process. So it would be at around 63. So I'm going to use a piece of tape to mark that number. And now I'm gonna insert the NG tube. So first, I'm gonna put some lube on it to make sure it goes in easy. And now, as I insert it, I'm gonna ask the patient to swallow every time. So could you please swallow every time that I insert this tube? Swallow.
While holding.
Swallow. Swallow.
Make resistance, and then twist. Twist around fingers.
Swallow.
Nothing else. And then coil
Swallow.
around the glove, remove. Put it in the glove, and throw it away.
Put the patient a little more comfortable. Ask them to
Now,
swallow.
intramuscular penicillin injection.
Swallow until the distance marker. There. And now I'm going to anchor it to the patient with a piece of tape. And I'm going to break it down the middle. A little more. And now I'm going to attach it to their nose. and wrap it around the tube.
This is my penicillin. This is my patient.
Okay.
This is my.
And now I'm going to inject air into the NG tube
Patient first.
and auscultate the abdomen to make sure that it is in the correct position. And I would remove this.
Syringe routing. Unscrew the subcutaneous tube.
Okay, it sounds like it's in about the correct place. So now I would aspirate some of the stomach contents.
That's ready. This away.
And I would close this.
And now, I'm going to clean the port.
I would clamp it closed. And now I would have a little cup where I would dump the stomach contents. And I would use a pH strip to dip it in. And then I would wait and see what color it turns. And based on what color it turns, I would determine the acidity of the stomach contents. It should be lower than 5. And then this I can discard. And now I will just secure this NG tube to the patient's gown to make sure it's not in the way. And that's it for Foley insertion. Now I would just place the patient in whatever position they would like to be comfortable. So would you like the bed lowered, the head of the bed?
Line it up.
Yes? About there. And then I would lower the bed again to prevent the patient from having any falls. Put the side rail up. And pick up any supplies. And make sure to discard of it properly. And now, the patient also has an order for 1 gram of vancomycin, IV piggyback. So here I have my vancomycin, and I'm going to be inserting it here. But first, I'm gonna use a alcohol swab to make sure it is clean. Okay. And the order is vancomycin 1 gram IV piggyback every 12 hours. So the vancomycin came in 500 milligrams per milliliter. So I'm going to be injecting 2 milliliters. And now, needle safety. And now I can hang this. I would prime it. I would prime the line and spike it. I'd prime the line, and then I would hang it and make sure that that bag is hanging lower. This is the piggyback, so it will be slightly higher. And I would clamp that one to this one and make sure that it is hanging lower. And then I would remove my gloves and dispose of any remaining materials.